Hello, it is Enid back with a cervical spine anatomy review. We're going to start at the upper cervical, which our C1 is also known as the atlas. It's atlas because it supports the cranium. It's real unique in that it is more of a ring-shaped vertebra as opposed to some of the others that have a distinct body. These superior facets that you'll see here, these kind of long, almost flat, even though they're concave, articular surfaces do articulate with the condyles of the occiput. This anterior arch, which is right here, articulates with the dens of C2. These are just some other bony landmarks. I thought it was a really clear picture, but so just kind of ignore the Get Body Smart on here. So here is our superior view of C1, and here's our inferior view of C1. So again, you have your articular processes. These are the superior ones that articulate with the cranium. You have your transverse process out here and out here. Your transverse foramen, which holds your vertebral artery, and your posterior tubercle, your anterior tubercle. This is just considered your posterior arch and your anterior arch. Looking from an inferior view, you're going to have your inferior articular processes here, and then everything else kind of aligns with the superior view as far as your transverse processes, your posterior arch, and then your anterior arch. And this is just a big fat close-up picture of the axis, which again, your odontoid process or your dens is the kind of characteristic feature of the C2. And here on the axis you have a similar picture. Here's your superior view with your odontoid or your dens, the superior articular facets, and with C2 you're going to have the spinous process, and if you do recall, when you palpate, C2 is the first spinous process you will feel because you cannot feel C1 from the posterior aspect. So here is the body of the vertebra, your lamina. You still have your transverse foramen for your vertebral artery. This is a lateral view, and you'll see the odontoid here, your articular facet, your spinous process, and your transverse processes. The atlantoaxial joint, which is your AA joint, okay, it's a plane joint in that it's planar. I don't want to say it's flat, but because of that kind of transverse orientation, this is where most of the rotation occurs in the cervical spine. 55% of the rotation occurs at the AA joint between C1 and C2. Okay, cervical intervertebral joints between the superior and inferior vertebral bodies and the adjacent intervertebral discs. So these are cartilaginous joints, obviously because they have the disc in there. Ligaments that we've learned about in the other parts of the spine will limit motion. Extension is limited by the anterior longitudinal ligament. Flexion is limited by the posterior longitudinal ligament, the ligamentum nuchae, and the ligamentum flavum. The ligamentum nuchae, as shown on this next picture, is an extension of the supraspinous ligament. So in other parts of the spine, this is called the supraspinous ligament, and then in the cervical spine, it's the ligamentum nuchae. Okay. And this photograph will show your supraspinous ligament. Your ligamentum flavum, your posterior longitudinal ligament, and then here is your anterior longitudinal ligament. It's a nice picture of it. Other bony landmarks in your typical cervical vertebrae And these are found in, C1 and C2 are going to be a little bit unique, but this is what the rest of them kind of look like. You definitely have your body, and you have these uncinate processes, which are a little bit, I guess, almost like a bony ridge, anterior and lateral, and I'll show you another view in a second. This is your transverse foramen again for your vertebral artery. Your superior articular facet is here, and then underneath here is your inferior articular facet. Your spinous process posteriorly, pretty common to have that bifid spinous process, because some people will feel, as they palpate, and feel like there's maybe two back there, but it's usually because it is bifid. Okay, here are some other pictures. When I was talking about the uncinate processes, you can see these from the anterior view here, and you'll see that little bit of a lip and mass there. On here, it's just another view of your body, transverse foramen, spinous processes. Here, just another view, another picture of some of the same landmarks. Okay, we are going into the prime movers for cervical spine flexion. We have your sternocleidomastoid, scalenes, and prevertebral muscles such as your longus colli and your longus capitis. Your sternocleidomastoid is your origin, sternum and clavicle, insertion mastoid, just as the name says. Bilaterally, it flexes the neck. Unilaterally, it'll laterally flex the neck to the opposite side. The SCM is innervated by the accessory nerve and C2-3. The scalenes, you have the anterior, middle, and posterior scalenes. Your origin is on the transverse processes of the cervical vertebrae, insertion on the first and second ribs. Bilaterally, it will assist in cervical flexion. Unilaterally, lateral flexion to the same side, but rotation to the opposite side. And innervated by the lower cervical nerves, C3 through C8. I think this is a really good picture. This is a superior view of your anterior, middle, posterior scalenes. This is your levator scapula. So it just kind of shows how the anterior and middle insert on that first rib, your posterior on the second rib. The longus colli and longus capitis, these are going to be your other cervical flexors, and you'll see a picture in just a second. The colli has three parts, has a superior, middle, and inferior part, and these are all on the transverse process. These are bodies from C3 to T3, and the insertion on the anterior tubercle of C1, bodies of C2, 6, transverse processes of C5 and 6. And so the colli will assist in lateral flexion and also does cervical flexion. The capitis is going to insert up on the occipital bone, so it's going to have more of an action on the head itself as far as flexion. And so here's a nice picture of your longus capitis on this side, and the longus colli. You can see the three parts. Here's your upper part, here's your middle part, and here's the lower.
Oh, that works.
So I'm actually still talking, but that's okay. We just had a freshman visitor, so are you good to go? Okay, thanks. Okay, cervical spine extension, sorry for that. Prime movers are your suboccipital muscles. So you get your obliquus capitis superior and inferior, your rectus capitis posterior major and minor, splenius capitis, splenius, oh I lost an L there, splenius cervicis, and erector spinae. Here's your splenius capitis and cervicis. You can see that your cervicis is mostly on the cervical spine into the thoracic, and then your capitis it does have that attachment point on the occiput, so it's going to have a direct effect on the head itself. Okay, and here's your origin, the capitis. Should have reversed these. The capitis, lower half of the nuchal ligament, and spinous processes of C7 through T3, which is down here, and then it's going to insert on the occipital bone and the mastoid process, so it'll extend the neck and laterally bend and rotate to the same side if contracted unilaterally. Both of these are innervated by the middle and lower cervical nerves. The splenius cervicis is spinous processes from C3 through T6. Inserts on the transverse processes of C1 through 3. Bilaterally it'll extend, and also unilaterally it'll laterally bend and rotate to the same side. And this is just a picture of your suboccipital muscles, your obliquus or obliquus capitis superior, your obliquus capitis inferior, and your posterior minor and posterior major. So when you look at these, because they're posterior, they're going to extend the head. They, because they're short, kind of stout muscles, they're going to stabilize this AO joint here. And they will also assist in rotation and lateral flexion to the same side. Cervical spine rotation, you've seen the list in some of these other muscles, the multifidus, rotator, semispinalis, SCM, and scalenes. This really should say unilaterally, will help with cervical spine rotation. This is a link to a website that just has kind of a really nice table of all of this outline that you might be interested in looking at. Okay, lateral flexion, you're going to get your intertransversarii. Unilaterally, you're going to get those obliquus muscles and the rectus capitis muscles that we just looked at, then your splenius capitis and your splenius cervicis. So they will do lateral flexion. Now I just have a couple extra pictures here that I just want to show you and share with you, and just kind of so you can see a relation between these muscles. In this left muscle, you have your spinalis cervicis. So these are your erectors, right? Your longissimus, your iliocostalis. Here's more of your longissimus, iliocostalis, and spinalis here. Okay. So those are your erector spinae. And here you'll get your rotatories, your semispinalis here, and multifidi here. And you can see how they span a couple joints and form that whole erector group. Here on the in that top picture, let's get to the right page here, is your interspinalis muscles. So you can see, being on the spinous processes, that they're going to help extend each level. And these are your intertransversarii muscles that also will help with lateral bending primarily. And then on the last page, or last slide here, we have just kind of your relations of your SCM to your splenius capitis, levator, scalenes are deep there, and then over the top here you have your upper trap. Here you have your semispinalis, splenius capitis, splenius cervicis. These are the same muscles on the other side, cut, and then deep to that is your suboccipital group. So that was, a quick review of cervical spine anatomy. Thanks for listening.